Hello everyone, we are here from Tapsi Electromedical Systems and Services. In video, we are present the computerized lumbar cervical ankle traction unit. This equipment is provided with standard accessories such as mains cable, safety switch, cervical collar, cervical spreader bar, instruction manual, ankle belt, chest belt and a lumbar belt, as well as a knee rest and traction table. This is lock for traction table. When we are going to treat the patient, firstly we have to unlock this lock so the table can move like this. To start the machine, we have to connect this main cord to the main socket. Main socket is behind the machine and we have to connect the cable. Then this is on and off key. We have to on it, and then we can see the display panel is start. First, now this is traction force knob. This is used to select the force of traction like this. Then this is static and intermittent mode key. From this key we can use static mode or intermittent mode. These both keys are only used in intermittent mode. This is the hold key and this is the rest key. Then this is a timer key. These both are timer key. This is used to increase the time and this is used to decrease the time. This is the start key and this is the stop key. As well as there is a patient safety key, so the patient can switch off the machine in any emergency. This is hold and release knob. This is traction cord and this is the hook. Hello everyone, we are from Tapsi Electromedical System and Services. In this video, we are going to represent how to give ankle traction. So this is a traction computerized lumbar cervical ankle traction unit, and this is traction table. And he is a patient. So first of all, we start the main switch. After that, we have to select the mode, static or intermittent. So from this static and intermittent key, we can select the mode. If we press the display panel, so the mode here is a STAT. It is a static mode, and INT it is intermittent mode. Okay. These both are hold key and rest key. These both are only effective in intermittent mode. From hold key we can increase the duration of hold like this, and from rest key we can increase the duration of rest like this. Okay, from this for the example we can select the intermittent mode and set the hold 20 second and rest phase 10 second and timer 10 minutes. Okay, now we release the knob so the traction cord can move. Firstly, we tie the belt, ankle belt, on the patient affected leg. So this is a ankle belt. So we have to place it at the patient's ankle. and these both are connected with hook like this, and we have to place patient's leg in front of a traction cord. Okay, after that we have to unlock the uh, table lock, traction table lock. It is at the here, so this we can I do it unlock, and now we start the treatment. Before we start, we have to hold the knob and we press start. So treatment is started and hold phase is show the hold period. Okay. Here it is a safety key. So in any case of emergency, patient can stop the treatment. Now it is a rest phase. And this knob is used to set traction force. If patient switch on emergency key, the display panel show this kind of message, keep safety switch off. Okay. Now we see how to give cervical traction to the patient. So this is a traction unit, and for the giving cervical traction we have to need cervical spreader bar and cervical collar. So now we start. We have to turn on machine. This is a static mode key and intermittent mode key. We have to select the mode, static or intermittent. I have to select it intermittent. In this I select hold 20 seconds and rest 5 seconds and time 10 seconds. If from this key we can change the time, duration of time. Okay, now we apply cervical collar to this patient. We are giving cervical traction in supine position, so we place cervical collar like this. Then we attach cervical collar to this spreader bar, and we attach the hook to this spreader bar. Okay, we select the 5 kg traction force and intermittent mode. Okay, now we set the hold and we start the treatment. Before we start treatment, we have to lock the traction table like this, so this traction table can't move. Okay, now we start the treatment. If any case of emergency, patient can use this emergency key so he can stop the treatment. If the patient press the key, machine is beeping. Okay. And treatment is stopped. Okay. In this video, we are going to see how to apply lumbar traction from this unit. First of all, we start the machine and we select a static mode or intermittent mode. For this video, we select static mode. In the static mode, hold key and rest key are not useful. These both are timer key. From this we can increase time, and from this we can decrease the time. We select 10 minutes, and okay, now we apply the lumbar traction in patient. This is a chest belt which is fixed with this bar, and this is a lumbar belt. First of all, we have chest belt. Then lumbar belt. Now, before we start, we have to unlock the table lock like this, so the table can move. Okay. And now we use the nearest equation. Body. Okay, we connect the hook to the lumbar belt. Okay. Now we start the treatment. For that we have to hold, set hold and start. Now treatment is started. And this is a lumbar traction position. Patient in supine and okay. Now you can see table is moving when we start treatment. Now we see how to fix this traction machine on the table.